Bump number 1 feels like a small, circular, pea-sized bump, usually at the top of the dog's incision. Sometimes over time, it feels less palpable. And what that means is just how when you touch it or around it with your finger, you might notice it a little bit more. And then as days progress, it's less palpable. You don't notice it as much. What this usually signifies is where the surgeon knotted the suture material beneath the dog's skin surface. Bump number 2 appears when a dog is lying down or seated, and then looks less noticeable when they stand. Usually what this signifies is where skin is folded over the layer beneath. So sometimes as their skin is kind of gathered up on itself, it's like a little flap, right? It's kind of like a muffin top, actually. Bump number 3 appears like a little puckered section of skin. The incision is still tightly closed though, and this is an important factor here. As the dog has, more swelling, usually toward the beginning stages of healing, you'll see that the skin will kind of start out looking flat, and then as the inflammation comes in day by day, you might notice that the skin kind of puckers up and it looks like a series of little bumps in between each of the sutures. If you see that and the skin appears closed, it's probably just a small section of puckered skin. Bump number 4 appears along the incision line. It might look like a small section that is pretty linear and raised up a bit, or it might look like it's pretty much the entire length of the incision. An important note here is that the incision left to right is still tightly closed and it's not oozing or anything. Now what this signifies is what's called a suture reaction. Sometimes the material that the surgeon uses for closure, not the closure at the top of the skin surface, the stitches that the surgeon removes, but I'm talking about deeper layers of stitching that they do. Sometimes there's an inflammatory reaction that happens beneath the skin surface, and then that shows itself as this linear type of bump. Bump number 5 looks and feels, when you give it a little poke, like a jiggly water balloon. Now, there is nothing oozing from this bump. It might grow, it might start out small, and then the next day look a little bigger and a little bit bigger. These things can actually get kind of large. It's not a little pea-sized bump. It is more like a water balloon looking thing. These usually signify what is called a seroma. The fluid inside the seroma, and it's just kind of like beneath the skin surface, there's a little layer that is empty that fills up with serous fluid. And the fluid does not contain, usually, bacteria or white blood cells or anything like that. So there really isn't a whole lot that we have to do about this. It's usually just a fluid-filled area, and your dog's body will resorb that fluid without us doing anything. Now, there are some surgeons who recommend using warm compresses, and then there are some who say, no, just leave it alone, it'll be okay. Bump number 6 is something that you'll feel relatively close to the surface of the skin. It might feel round, it might feel linear, it is immovable. Sometimes bumps like this are actually the hardware, the implant, whether it's the TPLO plate or the screws or pins. The TTA and the MMP, you won't be able to palpate the little implant. You just can't do it because of where it is anatomically. But certainly the TPLO screws are palpable. I can feel them even now on my dog's both of his hind legs. And then bump number 7, which is the most concerning one. Lots of times this can be close to the incision and might start out like this little tiny, almost pimple looking bump, and it might look so inconspicuous and so non-alarming. And then within hours, and certainly by the next day, this thing might have ruptured open. It might have a little pit in the center of it. It might look like it's oozing, or it might actually be oozing. It might get more red and angry looking. Your dog might have more of a tendency to want to lick this thing. Don't let that happen. This signifies a possible infection. So now you know the top 7 types of bumps that can happen along your dog's incision. There is so much more to learn, and I want to take you with me on this journey, so don't leave just yet. Click on the next video. I look forward to seeing you there.